so far?
So here we just want to pull out some key examples based on the preliminary findings of 3 case studies that we've done about communication activities during COVID-19 in 3 Asia-Pacific countries. So we've picked Taiwan, Singapore, and Sri Lanka. And the reason we want to do this is because so far as the situation has progressed, they have all had relatively low death rates from COVID-19. So we did the bulk of this research in July to August 2020. So just a heads up that things may have changed a little since then. So for example, Sri Lanka is now going through a major second wave, which started in October, and most of that is not really captured here. So just to flag the time in which we did these studies. So here's a snapshot of the current COVID situation as of the 10th of December 2020, based on the statistics from the Johns Hopkins University COVID Resource Center. And we've arranged the countries in order of increasing number of deaths. So as you can see, Taiwan has had just 7 deaths so far from COVID, and Singapore has had 29, and Sri Lanka so far 144, and it has increased a little since we pulled these statistics. So what I'm going to do now is I'm just going to go through what we've found so far from the case studies and flag some of the major points that arise from them. So let's, as we said in the ordering, let's start with Taiwan. So as we know, Taiwan has been having a particularly sophisticated digital strategy in their overall approach to COVID-19. And that, of course, has extended to their risk communication plans as well. So this case study really shows the government harnessing a lot of digital communications options in order to communicate to the public about COVID-19, both situation updates and also preventative measures that the public can take. So, for example, we have here the Center for Disease Control COVID information website, which gives you guidelines, press releases, and so on and so forth. There were also, at a point in the pandemic, daily press briefings given by the Minister of Health and Welfare. You also had hotlines, so the public could report suspicious symptoms in themselves or others, and regular public service announcements by the Vice President of Taiwan. And this is particularly interesting because we see the convergence of a political figure, the VP, who is also an epidemiologist. So he has the relevant expertise as well. Furthermore, these announcements were broadcast from the Office of the President and available online. So by broadcasting it from the President's office, it gives it that added layer of authority. And he was able to use this platform to communicate guidance on practices like mask wearing and hand washing. Then we did have this extensive use of mobile apps. So they were called MAPS maps or epidemic prevention maps. And this basically tells the public where they can obtain preventative supplies such as masks. Then we have the social media aspects, and I will go into that in more detail in the next slide, but just flagging it here for now. And of course, informational posters in public spaces telling people how to take precautions. So this, we have a listing of the types of messages that we found by looking at the CECC Facebook. CECC is the Central Epidemic Command Center of Taiwan, and it is affiliated with the Taiwan CDC. And also the Ministry of Health and Welfare Line account. So the types of information that they displayed here were updates on confirmed cases and also the specifics of their cases. So for example, the travel history of that person, where that person might have gone. Then of course, numerical updates on case counts, how to take preventative measures, and then updates on policy actions such as travel warnings, or if there was a restriction on travel or some kind of border control information that needed to be updated. Then there were also links to the other information sources as well, so like the CDC website and so on. Then guidance on if one was to visit a healthcare facility, how to keep safe. Then updates on the scientific information regarding COVID-19, updates on investigations and case clusters, and then of course policies that the government had in regard to quarantine, and updates on various restrictions. And then of course the very important policy of clearing up rumors and misinformation. And we flagged earlier the importance of getting in early and kind of beating the rumors to it so that you're not caught up in that cycle of rumor management. So in addition, for the messaging category, we also noticed there was a lot of use of humor. So comedians were actually asked by the government to create memes, and they also used animal mascots to communicate about staying safe. And then there was also a use of images, as we saw in the Line account, about how to take precautions like putting on a mask or washing. So that's Taiwan. Now let's move on to Singapore. Like Taiwan, there is also a lot of use of digital media, but also conventional media. So in the conventional media, we had weekly press briefings at one point in the pandemic with main government officials. And there was also attempts to make some of these announcements multilingual to reflect the multilingual diversity of the country. So in terms of social media and digital media, there was a COVID-19 WhatsApp channel, and this would basically send 2 to 3 updates every day with, for example, misinformation and scam alerts, and also linking to credible information sources and government advisories. Then we saw a lot of social media activity from the Facebook of the Prime Minister, Lee Hsien Loong. And then on Twitter, the Singapore Ministry of Health, the government of Singapore's Twitter account, and also the Prime Minister's Twitter account. And there is also an extensive YouTube presence of the government of Singapore that actually has a lot of COVID-19 related content. I will revert back to some of the examples from that YouTube account later on. And then there's the hotline that you can call for inquiries on COVID. And then there was an extensive use also of informative apps and websites. I've just listed 4 here, but there's a lot more than that. What's interesting is you can see here that it's not just about health aspects. So for example, the COVID-19 Chat for Biz chatbot allowed people to ask business-related questions about COVID, like how the current situation might affect a business. And then you have FluGoWare, which provides resources for people with respiratory illnesses. MaskGoWare, which helps tell you how to get a mask. And the Trace Together contact tracing app. Furthermore, we have the DORSCON level system in Singapore, which stands for Disease Outbreak Response System Coordination. And it's organized into 4 levels from green to red. So this is an easy way of signaling in a very simple manner the level of risk in a way that's easy to understand. So then in terms of the messaging, there was openness about uncertainty of the disease. And in the last point, I will just highlight the sort of philosophy of the government of Singapore was to use what they call defensive pessimism. And this links back to what we were talking about earlier in terms of risk perception and getting people to perceive risk. So on the one hand, you need people to understand that the risk is high enough that one needs to take certain precautions to keep safe, but also you don't want risk perception to fall once people feel like they've taken the precaution. So it's this balancing act between making sure people take precautions and feel safe, and also not making them too complacent. So this philosophy of kind of defensive pessimism allows them to heighten concern about COVID-19 and not making people too complacent. Then in terms of social media, the government of Singapore Twitter account also sent condolence messages for individual deaths on Twitter. And like I mentioned earlier, the government of Singapore YouTube account was very active with COVID updates, giving press conferences. They asked celebrities and experts to do videos, and also giving inspirational messages. And some of the videos were in multiple languages as well. So here is our final case study of Sri Lanka, which is our LMIC example here. So the Health Promotion Bureau around January and February released this detailed risk communication and community engagement plan. I'm not going to go to the plan in so much detail, but I have just put this graphic up, which illustrates how the Health Promotion Bureau how they interacted with other departments and other institutes within the Ministry of Health system in Sri Lanka in order to get up-to-date information about COVID-19. So some of the features of this communication strategy is that there was a bigger reliance on conventional media. So one of the big aspects of risk communication was that during the first period of lockdown and curfew, which was around mid-March to late April 2020, there were daily press briefings. And it featured the then Director General of Health Services, Dr. Anil Jasinghe, the Minister of Health, Pavitra Vaniarachi, and the Lieutenant General Shavendra Silva, who is also in the COVID-19 task force, among others. But these 3 were some of the main figures who were featured. Then in terms of online information, We had the website of the official Sri Lankan response to COVID-19, the National Operations Center for the Prevention of COVID, the Health Promotion Bureau COVID-19 dashboard, and that provides verified information on case counts, so cumulative case counts, daily increase in cases, number of deaths, and so on. There's a dashboard where you can easily access that information in numeric form. And then the epidemiology unit of the Ministry of Health, which, excuse me, gave us case counts updates and also circulars and directives and guidelines that have been issued by the authorities. In terms of app, there was an app called My Health Sri Lanka, which was launched through a collaboration with ICTA, the ICT agency of Sri Lanka, and also the Ministry of Health. And the goal of the app was to, again, give information and updates on COVID-19 in Sri Lanka and also direct people to useful resources. In terms of social media, there was some social media activity. So, for example, the Health Promotion Bureau and the Department of Government Information have official Viber channels that you can subscribe to get updated information on COVID-19. And then we also see Facebook and Twitter activity by, excuse me, the relevant authorities, such as the Health Promotion Bureau, the President, the Prime Minister, and the Minister of Health. There is also the COVID-19 1390 hotline that anybody can call if they want to report symptoms. And then there's the Department of Government Information that puts out regular press releases on COVID-19, and that includes daily case counts, deaths, and also updates on any curfew or restrictions that have been put into place as epidemic control policies. So that sort of left us with the question, beg your pardon, to what extent are the WHO recommendations actually being used? So in the next section, what we did was we looked at some of the WHO recommendations that we talked to you about in the first part of the presentation, and then we looked for evidence in the communications activities of them being followed. So it's important to note that at this stage, this is not a full evaluation of these communications activities. Like, we didn't evaluate each and every activity for reach and effectiveness, for example. And you will also see a few blank cells in the table. And the blank cell doesn't necessarily mean this activity did not happen or this recommendation was not used. It's just that at this stage, we were not able to find evidence of it as of now. So we've focused here primarily on the A and C criteria because, as we pointed out earlier, the B criteria was largely about like finance and infrastructure aspects of risk communication, which we didn't really cover in our study. So in terms of the trust recommendations, we see that all three countries had made attempts to link to functional and accessible services. So in Taiwan, we had the links back to the CDC website. In Singapore, we had the specialized apps and websites. And in the Sri Lanka public health system, you have contacts available at the very granular level. And one of the most granular levels is the public health inspectors. And the telephone numbers of the PHIs and the PHI officers are freely available online. And it's possible to contact your local PHI. For transparency, it was kind of difficult for us to fully assess it at the stage, because to properly assess that, we'd have to take statements and then try to validate them against ground truth. So we didn't really have the scope to do that until that point, as of this point. So we've left that out for now. In terms of timeliness, we've seen evidence throughout the pandemic that all three countries adopted some form of regular updating or regular briefing. It needs to understand, of course, we saw in Taiwan the use of humor, in Singapore, multilingual videos and JOSCON. And in Sri Lanka, we can see on the Health Promotion Bureau website, there were many easy to understand graphics with bullet points saying what to do if you're sick, and so on. Acknowledging uncertainty, we know from the Singaporean strategy of defensive pessimism that there was an acknowledgement of the scientific uncertainty regarding the virus. But as of this point, we were not able to find similar for Taiwan and Sri Lanka. Continuing with the trust recommendations, in terms of addressing and engaging affected populations, given that all three are quite small countries, you have a very strong national level response that attempts to reach as many people as possible. In Singapore, we did find that there was some targeted communications, for example, in Tamil. During the outbreak in the migrant worker dormitories, there has been some criticism of the Singaporean strategy in how they did handle this. Then by self-efficacy, we mean, were the communications actually giving people actionable insights that they could use to protect themselves from the pandemic? And we found evidence of that in all three. In Taiwan, and we have the information about the preventative measures and where you can get supplies. In Singapore, we have the specialized apps, and in Sri Lanka, also on the Health Promotion Bureau website, we had instructions on how to keep safe. Multiple platforms, methods, and channels, that is already evident from the case studies. Then when it comes to social media, we saw that in Taiwan, there was a very in-depth digital media strategy, and we've highlighted that. Singapore, we've also highlighted this in the previous slides. In Sri Lanka, we have also seen social media activity, but we've found that it's been a less prominent mode of RCCE, and there's been more reliance on conventional media, in particular television. There's a much bigger reliance on TV. Then in terms of assessing whether social media and traditional media were an integrated strategy, this is difficult to ascertain, again, because of the difficulties in checking deeper for consistency across different communication modes. We'd have to go much deeper than we've done so far. Furthermore, about messaging, in Taiwan, we did see that risk was explained using humor, so it made the messages more relatable and easier to understand. Then Singapore, as I mentioned, the Gov Singapore YouTube account, you had these very short think before you do videos with easy to follow advice on staying safe. Like if you wanted to go out, here's how you could stay safe. And then in Sri Lanka, we also had these easy to understand graphics on the COVID-19 prevention website. Then, as I said previously, consistency we could not check for at this stage. And in the promoting specific actions, we have dealt with that in the self-efficacy category. The first lesson that we wanted to take away from this case studies was that the government should be mindful of which channels of communication people are most likely to access and direct messaging towards those. And one of the big examples of this is social media. Even though social media does feature in a lot of RCCE strategies, the effectiveness and reach is going to depend on the existing context of those countries. Second, and there might be a different balance between social media and also conventional media. Secondly, it is important to set the expectations early. So like we've said, acknowledging that knowledge about the disease is uncertain and likely to evolve. So for instance, in Singapore, we saw this with the defensive pessimism strategy that was employed. And it will also help to stymie any rumors that might emerge in this. And then we have the holistic communication that is tailored to specific contexts. Because as we said earlier, even though we could not go into as much depth about this, it is important for governments to be sensitive to specific national contexts as well as communication targeted towards groups that might be exceptionally vulnerable due to health, economic, or other reasons. So for example, in health, anybody with a pre-existing health condition, economic, because pandemics affect people differently depending where they are on the economic strata, or other reasons, including stigmatization. So, I mean, there are many lessons we can learn, but these were the three main ones we wanted to take away. That so, in a nutshell, it's figuring out the importance of figuring out which channels of communication are the most effective. The importance of controlling messaging and setting realistic expectations early. And thirdly, the importance of holistic communication that is targeted towards different groups. And that is pretty much all we had. So before we thank you and sign off, we want to acknowledge the contributions of two of our Learn Asia research interns who made very valuable contributions towards gathering the background research for these case studies. Yes, so thank you. Thank you for listening.